If you're over 50, making certain changes to your dietary habits can make a significant difference in slowing prostate growth. Urologists have identified 5 important dietary modifications that can slow the progression of prostate enlargement. Including these changes in your daily diet can support your medication treatment and help alleviate your symptoms. Research shows that benign prostatic hyperplasia, BPH, affects approximately 50% of men by age 60, increasing to over 80% by age 80. This progressive condition, characterized by non-cancerous enlargement of the prostate gland, can significantly impact quality of life through symptoms like frequent urination, weak urine flow, and nighttime awakenings. Yet what many men don't realize is that certain dietary factors can either accelerate or slow this growth process. What's particularly encouraging is that making specific nutritional changes can complement conventional treatments and potentially reduce the need for medication adjustments or more invasive interventions over time. Let us know where you're watching from and how old you are in the comments below. The connection between diet and prostate health has gained increasing attention from urologists who specialize in men's health. What's consistent across these specialists' observations is that certain nutritional patterns appear to influence the physiological processes that drive prostate growth, offering a complementary approach to managing this common condition. When researchers first began investigating the relationship between nutrition and BPH, many were surprised to discover how significantly dietary choices appeared to influence prostate growth rates. However, as our understanding of the hormonal and inflammatory pathways involved in BPH has advanced, the biochemical mechanisms behind these dietary effects have become clearer. I'm Dr. Rachel, and for over 25 years, I've specialized in urology with a focus on men's health and prostate conditions. Today I'll share information about 5 critical dietary changes that research suggests may help slow the progression of prostate enlargement. Modifications that, when implemented consistently, might help complement your medical treatment and potentially improve your quality of life. Before we explore these dietary modifications, I'd like to ask you to subscribe to our channel and turn on the notification bell. Each week, we share evidence-based approaches to men's health focused on practical, accessible strategies. If you're interested in ways to support your prostate health naturally, you won't want to miss our upcoming videos. These dietary changes are worth examining because they influence the core physiological processes that drive prostate growth, including hormonal balance, inflammation, and cellular proliferation. To understand why these nutritional modifications can be effective, let's first look at what causes the prostate to enlarge with age. BPH develops through the influence of several interconnected factors. Hormonal changes, particularly the balance between testosterone and its more potent metabolite dihydrotestosterone, DHT, play a central role. Chronic inflammation in prostate tissue creates an environment conducive to cellular growth. Oxidative stress damages cellular components and triggers growth responses. And certain growth factors stimulate prostate cell proliferation. Importantly, each of these processes can be influenced by dietary choices. With these mechanisms in mind, let's examine the 5 dietary changes that urologists have identified as potentially beneficial for slowing prostate enlargement in men over 50. The 5 critical dietary changes for prostate health. The first critical dietary change is increasing consumption of plant-based foods rich in specific plant compounds called phytosterols and polyphenol. These natural plant chemicals appear to help regulate the hormonal processes involved in prostate growth through several mechanisms. Phytosterols, which are structurally similar to cholesterol, can help inhibit 5-alpha reductase, the enzyme that converts testosterone to DHT. Since DHT is a primary driver of prostate cell proliferation, reducing its production may help slow prostate growth. Foods particularly rich in beneficial phytosterols include pumpkin seeds, sesame seeds, sunflower seeds, and certain legumes. Polyphenol, especially a group called flavonoids, demonstrate anti-inflammatory and antioxidant properties that may help counter the inflammatory processes contributing to prostate enlargement. Berries, especially blueberries, strawberries, and blackberries, apples, citrus fruits, onions, and dark leafy greens are excellent sources of these beneficial compounds. Research suggests that men who consume more of these plant foods tend to have lower rates of BPH progression. One notable study published in the American Journal of Clinical Nutrition found that men with the highest intake of vegetables and fruits had a 32% lower risk of BPH compared to those with the lowest intake. The shift toward more plant-based eating doesn't require becoming vegetarian. Rather, it involves ensuring that plant foods comprise a larger proportion of your daily meals. Practical approaches include adding a serving of berries to breakfast, incorporating a large salad with lunch, snacking on seeds, and ensuring vegetables cover at least half your dinner plate. The second dietary change that may help slow prostate enlargement is reducing consumption of inflammatory foods, particularly those high in refined carbohydrates, unhealthy fats, and artificial additives. These foods can promote systemic inflammation, which may exacerbate prostate tissue inflammation and contribute to enlarged prostate symptoms. Refined carbohydrates, including white bread, white rice, processed breakfast cereals, and sugary foods, cause rapid blood sugar spikes that can trigger inflammatory responses. Studies have found associations between high glycemic diets, those that cause large blood sugar fluctuations, and increased prostate volume. Unhealthy fats, especially trans fats found in fried foods and some processed foods, as well as excessive omega-6 fats from certain vegetable oils, can promote inflammatory pathways in the body. These inflammatory signals may reach the prostate tissue and stimulate growth processes. Artificial food additives, preservatives, and synthetic ingredients in highly processed foods may disrupt hormonal balance and promote inflammatory responses in sensitive individuals. While direct research on these substances and BPH is limited, many urologists observe clinical improvements when patients reduce their intake of highly processed foods. Replacing these inflammatory foods with whole, unprocessed alternatives can help create an anti-inflammatory dietary pattern. Practical approaches include choosing whole grains instead of refined versions, preparing more meals at home from basic ingredients, reading labels to avoid artificial additives, and moderating intake of fried foods and processed snacks. The third dietary change that appears to benefit prostate health is optimizing zinc intake through appropriate food sources. Zinc plays several important roles in prostate health, and while both deficiency and excess can be problematic, ensuring adequate levels through diet may help regulate prostate cell growth. The prostate contains the highest concentration of zinc of any organ in the male body, suggesting its importance for normal prostate function. Research indicates that zinc can help inhibit the activity of 5-alpha reductase, similar to certain prostate medications, and may help regulate the balance of prostate cell growth and natural cell death, apoptosis. Food sources of zinc particularly beneficial for prostate health include pumpkin seeds, oysters, crab, beans, chickpeas, and certain nuts like cashews and almonds. These foods provide zinc in forms that the body can regulate, unlike supplements which may lead to excessive intake. While zinc supplements are widely marketed for prostate health, urologists generally recommend focusing on food sources rather than supplementation for several reasons. Excessive zinc intake through supplements can actually suppress immune function and potentially interfere with the absorption of other minerals. Additionally, some research suggests that high-dose zinc supplementation might paradoxically increase risk for certain prostate conditions. The optimal approach appears to be consuming zinc-rich foods regularly as part of a balanced diet, which allows the body's natural regulatory mechanisms to maintain appropriate levels. For men taking medications for BPH, consulting with healthcare providers before using any supplements is particularly important to avoid potential interactions. Robert, a 67-year-old who had been managing BPH for several years, implemented these first 3 dietary changes after discussing options with his urologist. My symptoms had been gradually worsening despite medication, and I was looking for additional approaches, he explains. My doctor suggested these dietary modifications as a complement to my medical treatment. After about 3 months of consistently applying these changes, Robert noticed improvements. The nighttime bathroom trips decreased from 3 to 4 to usually just 1 to 2, and I experienced better urine flow during the day. It wasn't an overnight miracle, but the gradual improvement has made a real difference in my quality of life. What surprised Robert most was how these dietary changes affected his overall well-being. Beyond the prostate benefits, I've noticed more energy, better digestion, and even improved joint comfort. It's been a reminder that everything in the body is connected, and positive changes tend to have ripple effects. The fourth dietary change that appears beneficial for prostate health is moderating overall calorie intake and maintaining healthy body weight. Research consistently shows that excess body weight, particularly abdominal fat, is associated with faster progression of prostate enlargement and more severe symptoms. The connection between body weight and prostate growth involves several mechanisms. Excess body fat, especially abdominal fat, produces inflammatory compounds that can reach the prostate and stimulate growth pathways. Fat tissue also contains an enzyme called aromatase that converts testosterone to estrogen, potentially disrupting the hormonal balance that affects prostate growth. Additionally, excess weight is associated with insulin resistance and metabolic syndrome, conditions that create a physiological environment conducive to tissue growth and inflammation throughout the body, including in the prostate. Studies have found that men with higher BMI body mass index tend to have larger prostates and more severe BPH symptoms. Conversely, weight loss in overweight men has been associated with improvements in prostate symptoms, suggesting that achieving and maintaining healthy body weight may help slow prostate enlargement. The approach to weight management for prostate health doesn't involve extreme dieting, which can create additional stress and potentially worsen inflammation. Instead, moderate calorie reduction combined with regular physical activity appears most effective. Practical approaches include controlling portion sizes, minimizing eating after dinner, increasing physical activity, and focusing on nutrient-dense foods that provide satiety with fewer calories. The fifth dietary change that may benefit prostate health is optimizing fluid intake timing and type. While adequate hydration is important for overall health, the pattern of fluid consumption can significantly impact urinary symptoms in men with enlarged prostates. Many men with BPH reduce their overall fluid intake in attempts to minimize urinary frequency, but this approach can actually worsen symptoms. Concentrated urine can irritate the bladder, potentially increasing urgency and frequency, while inadequate fluid intake can contribute to constipation, which may exacerbate prostate symptoms through increased pressure on the gland. Research suggests that the timing of fluid consumption may be more important than the total volume for men with BPH. Concentrating fluid intake in the morning and early afternoon, while reducing evening consumption, can help minimize nighttime urination while maintaining adequate hydration. The type of fluids consumed also appears significant. Caffeine and alcohol act as diuretics and bladder irritants, potentially worsening urinary symptoms, especially when consumed later in the day. Some studies suggest that caffeine may also stimulate prostate cell growth through effects on cellular signaling pathways. The optimal approach appears to be consuming most fluids, about 1.5 to 2 liters total, earlier in the day, primarily as water, herbal teas, and moderate amounts of milk. Limiting caffeine and alcohol, especially after mid-afternoon, can help reduce nighttime urinary symptoms while maintaining proper hydration. Thomas, a 72-year-old with moderate BPH symptoms, found that adjusting his fluid consumption pattern made a significant difference. I used to restrict fluids all day trying to reduce bathroom trips, but would get thirsty in the evening and drink a lot before bed, he shares. My urologist suggested concentrating my fluid intake in the morning and early afternoon, and it's made nighttime much more manageable. After implementing all 5 dietary changes, Thomas experienced notable improvements. The combination of these changes, along with my medication, has given me much better control over my symptoms. I'm sleeping better with fewer interruptions, and daytime urgency is much less of an issue. The dietary approach has definitely enhanced the effectiveness of my medical treatment. What Thomas found particularly valuable was how these changes empowered him to actively participate in managing his condition. Rather than feeling like a passive recipient of treatment, these dietary adjustments gave me ways to positively influence my health every day. That sense of participation and control has been psychologically beneficial beyond the physical improvements. Let us know where you're watching from and how old you are in the comments below. While these 5 main dietary changes provide a solid foundation for supporting prostate health, there are several additional nutritional considerations that might be relevant depending on your particular situation. These targeted modifications might be worth discussing with your healthcare provider. Additional nutritional considerations for prostate health. For men experiencing significant inflammation, targeted anti-inflammatory foods may provide additional benefits. Omega-3 fatty acids found in fatty fish like salmon, mackerel, and sardines have potent anti-inflammatory properties. Turmeric contains curcumin, which has shown promising anti-inflammatory effects in some prostate studies. Tart cherries contain anthocyanins that may help reduce inflammatory markers. These foods can be incorporated into a diet already following the 5 main changes we've discussed. For men with strong family history of prostate issues, certain protective foods might be particularly important. Lycopene-rich tomato products, especially cooked tomato sauce, which increases lycopene bioavailability, have been associated with prostate health in multiple studies. Cruciferous vegetables like broccoli, cauliflower, and Brussels sprouts contain compounds called indoles that may help optimize hormonal metabolism. Regular consumption of these foods might provide additional protection for those with genetic predisposition to prostate problems. For men taking specific medications for BPH, certain food interactions may be worth considering. Some alpha blocker medications commonly prescribed for BPH can cause blood pressure fluctuations that might be exacerbated by alcohol or stimulants like caffeine. 5-alpha reductase inhibitors, like finasteride or dutasteride, work through hormonal pathways that might be influenced by certain foods. Discussing potential food-drug interactions with your healthcare provider can help optimize your overall treatment approach. James, a 74-year-old with a family history of prostate issues, found that incorporating these additional considerations alongside the 5 main dietary changes was particularly effective. Given my family history, I wanted to be as proactive as possible, he explains. I incorporated more cooked tomato sauces, cruciferous vegetables, and fatty fish into my diet, in addition to the other changes my urologist recommended. After 6 months of this comprehensive nutritional approach, James experienced significant benefits. My most recent checkup showed that my prostate hadn't enlarged further, which was a change from the steady growth I'd been experiencing for years. My symptoms have improved considerably too, with much better urinary flow and less nighttime disturbance. What James appreciated most was how these dietary changes integrated with his overall health goals. As I've gotten older, I've become more conscious of how my food choices affect every aspect of my health. These prostate-friendly changes align perfectly with heart-healthy and brain-healthy eating, so I feel like I'm supporting my entire body with each meal, not just my prostate. The science behind diet and prostate growth. The recommendations for these dietary changes are supported by a growing body of scientific research, including both epidemiological studies and clinical trials. Understanding this evidence can help motivate consistent implementation of these potentially beneficial changes. Multiple large-scale observational studies have found associations between dietary patterns and BPH risk or progression. A notable study published in the American Journal of Epidemiology followed over 4,700 men for 7 years and found that those following a diet rich in vegetables, fruits, and whole grains had a 33% lower risk of BPH surgery compared to those eating a typical Western diet high in refined carbohydrates and animal products. The effect of plant compounds on prostate growth has been examined in laboratory studies. Research published in the Journal of Nutritional Biochemistry demonstrated that certain plant sterols and flavonoids can inhibit 5-alpha reductase activity and reduce inflammatory signaling in prostate tissue. These mechanisms parallel how certain prostate medications work, suggesting that these dietary compounds might provide complementary benefits. Clinical trials examining zinc's role in prostate health have shown mixed results, likely reflecting the complex relationship between zinc levels and prostate function. Research published in the Journal of Urology found that zinc levels in prostate tissue were significantly lower in men with BPH compared to those with normal prostates, suggesting that appropriate zinc intake might support normal prostate function. However, other studies caution against excessive supplementation, highlighting the importance of obtaining nutrients through food sources whenever possible. The connection between body weight and prostate enlargement has been demonstrated in multiple studies. Research published in the International Journal of Obesity found that each 5-point increase in BMI was associated with a 40% increased risk of BPH progression. Another study in European urology showed that weight loss in overweight men led to significant improvements in urinary symptoms, suggesting that weight management interventions may provide therapeutic benefits for prostate health. Now, I want to share what might be the most important factor for success with these dietary changes, something that urologists consistently emphasize. The key factor appears to be consistency and patience. Unlike medications that often produce noticeable effects within weeks, dietary changes typically influence prostate growth more gradually by affecting the underlying biological processes. Many men report that it takes 2 to 3 months of consistent dietary changes before noticing significant improvements in symptoms, with benefits continuing to develop over 6 to 12 months of sustained implementation. It's also important to recognize that these dietary approaches work best as a complement to, not a replacement for, medical care. The most successful outcomes typically come from integrating appropriate nutritional changes with conventional treatments under the guidance of healthcare providers. This integrated approach allows for potential medication adjustments based on symptom improvements from dietary changes, creating a personalized treatment plan that may minimize pharmaceutical side effects while maximizing symptom control. Michael, a 79-year-old who implemented these dietary changes alongside his medication regimen, emphasized the importance of this complementary approach. I initially hoped that dietary changes might allow me to stop my medication entirely, he shares. But my urologist helped me understand that the goal was to enhance the effectiveness of my treatment and potentially slow the progression that might otherwise require increased medication or surgical intervention. After maintaining these dietary changes for over a year, Michael experienced significant benefits. My symptoms have remained stable rather than progressively worsening as they had been before. My medication dosage hasn't needed to be increased, which has helped me avoid additional side effects. And I've experienced improvements in other aspects of health as well, from better energy to improved cholesterol levels. What Michael found most valuable was the long-term perspective this approach provided. These dietary changes aren't a quick fix, but rather an investment in my long-term health. At my age, I'm interested not just in managing today's symptoms, but in maintaining the best possible quality of life for years to come. This approach feels sustainable and beneficial across multiple dimensions of health. For those interested in implementing these dietary changes, I recommend starting with 1 or 2 modifications that seem most achievable for your current lifestyle and preferences, then gradually incorporating others as these initial changes become habitual. Many men find that beginning with increasing plant foods and adjusting fluid timing provides noticeable benefits that motivate further changes. It's also helpful to approach these modifications as additions rather than deprivations, focusing on adding beneficial foods rather than just eliminating less helpful ones. This positive approach tends to be more sustainable and enjoyable, increasing the likelihood of long-term adherence. Remember that individual responses to dietary changes can vary based on your specific prostate condition, overall health status, medications, and genetic factors. Working with healthcare providers who understand the relationship between nutrition and prostate health can help you develop a personalized approach that addresses your particular needs and circumstances. It's worth noting that while these dietary changes may help slow prostate growth and improve symptoms for many men, they may not be sufficient for those with severe BPH or complications like urinary retention. In these cases, dietary modifications can still provide benefits as part of a comprehensive treatment plan that might include more intensive medical or surgical interventions. Let's summarize the 5 critical dietary changes that may help slow prostate enlargement in men over 50. Increase consumption of plant foods rich in phytosterols and polyphenol, including seeds, berries, and leafy greens, which may help regulate hormonal processes involved in prostate growth. Reduce intake of inflammatory foods, particularly refined carbohydrates, unhealthy fats, and artificial additives, which can promote systemic inflammation that may exacerbate prostate growth. Optimize zinc intake through appropriate food sources like pumpkin seeds, oysters, and beans, which may help regulate prostate cell growth and function. Moderate overall calorie intake and maintain healthy body weight, as excess weight, particularly abdominal fat, is associated with faster progression of prostate enlargement. Optimize fluid intake timing and type, Concentrating consumption earlier in the day and limiting caffeine and alcohol, especially in the evening, to help manage urinary symptoms. Additional considerations include targeted anti-inflammatory foods, protective foods for those with family history of prostate issues, and attention to potential food medication interactions. By implementing these evidence-based dietary changes consistently over time, you may be able to slow the progression of prostate enlargement, enhance the effectiveness of medical treatments, and improve your overall quality of life. While not a replacement for appropriate medical care, these nutritional strategies offer a complementary approach that addresses the underlying biological processes involved in BPH. If you found this information valuable, please consider sharing this video with others who might benefit. Many men experience prostate enlargement as they age, but are unaware of how dietary choices might influence this condition. Subscribe to our channel for more evidence-based approaches to men's health, and tap the notification bell so you never miss an upload. Each week, we explore different aspects of well-being for aging men, always focused on practical, accessible strategies. Thank you for joining me today. I wish you excellent health in the years ahead. Until next time, take good care of yourself.